Welcome. My name is Pam Villagomez, and I'm happy to invite you and welcome you to our first webinar in the series of Breaking It Down with the Experts. And tonight's topic is twist in knee, common injuries of the knee and lower leg. On tonight's webinar, we're going to address various questions that may be common to many, but particularly looking to see how we can prevent injuries, especially in dancers that are more prone to these types of injuries. So our jazz dancers, our contemporary Broadway dancers, and beyond. Our speakers today are from our HSS Florida location, Dr. Davenport, physiatrist, and also Maddison DiSchino, a physical therapist. Just to kick us off, what are the most common knee injuries you see in dancers?
So I can start with that, and then I'll throw it over to Maddison to continue. A lot of what I see in dancers tend to be overuse injuries. We know that for a lot of dancers, that's the most common type of injury. So patellofemoral syndrome, which goes a lot with hip alignment and things like that. Some tendinitis, those types of things are some of the most common things that come into my clinic.
I would agree with exactly what Dr. Davenport said. A lot of times we're seeing those patients that have the overuse injuries. So maybe they're doing something repetitively incorrectly, maybe, which can kind of lead to further irritation of the issue. And then it becomes more of a chronic issue. So that's generally what we're seeing. And again, with the knee and lower leg, a lot of times that tendinitis and that patellofemoral syndrome.
The patellofemoral is so common in so many aspects of activities. You mentioned, Dr. Davenport, the connection with hip alignment. So like, how do you know which one comes first, in that scenario, the chicken or the egg, like the hip or the knee?
They usually go together. And so a lot of times we always talk about our exam in a clinic is looking at the joint above and the joint below. And a lot of times I talk about the knee being a victim of how the hip is working as well as the ankle. So if the hip is not engaged and the foot and ankle is rolling in, sometimes dancers have gotten a correction to not roll in. That's how the knee is going to start getting into some forces through the knee that's not going to be optimal for knee health. And so if we just looked at the knee in a little isolation, a lot of times we're going to miss the major issue of what's going on. And so when we have something that's happening with knee pain, I need to look at a dancer functionally. I need to see their plie. I need to see how they're moving through space. And the most important thing is seeing how that hip is controlling the knee and seeing how that's working together with the foot and ankle alignment. And so a lot of times it's that whole, what we call the kinetic chain, hip, knee, foot and ankle, that's really getting to a lot of our issues. Even though the dancer is coming in for knee pain, Maddison might spend the whole time with hip rehab on that. So I'll let her speak more to that subject, but we see that very commonly. Sometimes I have to be very careful when I'm sending a patient off to physical therapy to tell my dancer, hey, by the way, I know you came in for knee pain, but we're going to be doing hip strengthening for several weeks. Because otherwise I'll have dancers come back and say, well, therapy, they didn't know what they were doing. They were just strengthening my hip. And so I'm like, okay, we need to make sure I'm setting Maddison up for success here.
Yeah, I think making sure the patient knows, so the dancer knows kind of why we're working on what we're working on. Because yes, the hip a lot of times is what's causing a problem at the knee. And sometimes, like Dr. Davenport said, it could actually be the foot or the ankle that's causing the problem as well. And it could be a combination of the hip and the foot and ankle, not just one or the other. So a lot of times I find with most dancers, not even just dancers, honestly, people in general, their hips are usually pretty weak anyways. So it's always something important to address because it can lead to so many issues, not just at the hip, but the knee, the ankle, the foot. So especially when we're looking into that at knee, you always want to look above and look below to see kind of what else maybe could be going on that's causing the problem.
Great. Fascinating. Thank you so much. I kind of veered off on a tangent there, but kind of led me there. So in terms of the common knee injuries, are there any dance moves in particular that kind of lead to greater risk of injury?
So for dance moves, we talk a lot about transitional movements. And by that, I mean kind of jump loading, like let's say a plie before a jump or jump landing, or then transitioning on and off the ground, if you're doing a lot of floor work. So those types of transitional movements can be some at-risk moments that we look at very carefully and talk about. The nice thing about dance, though, is that it really trains knee mechanics. Like you're supposed to land softly. You're supposed to land through the whole foot. You're supposed to control the knee. And so a lot of dancers have been trained to actually use their knee very well through those movements. And that's why a lot of times I get to be kind of the good guy, bad guy of saying like, actually listen to your teachers. If you've been getting these corrections of landing without rolling in, or getting on and off with better, straighter knees. I've had that one in my dance training. There's a reason, there's a method behind the madness when dance teachers and dance educators are focusing on this. It's not just for a look, it's actually for longer, healthier dancing.
Yeah, definitely the loading before and after jumps, the absorbing of the shock, exactly like Dr. Davenport said, that toe ball heel that you learn to land with, soft landings, all those cues that you hear, they are really important. And sometimes in the PT standpoint, we work on all of those cues that the dance instructors can give you, but we also want to work on the strength in order to do them. So sometimes you can get those cues all you want, you either don't understand them or you can't physically do it. So PT can definitely play a big role in helping that as well.
Thank you. So would you say that that cue for loading is given across all dance specialties? Because I think of like tap, and that seems like a very different type of loading mechanism and potentially impact.
That's a great question. And it really, so the answer is yes and no. Most dance techniques do talk about some kind of technique with loading, but a lot of times the language is very different. So tap, a lot of the cueing can be throwing the foot, but in order to have one foot be loose, they talk a lot about in the tap world being grounded, on the other side. So that is the loading on kind of your stability side. And in tap, even though we think about tap being in the ground or loading, there's a lot of jumps and a lot of turns and a lot of explosive movements that are also part of tap technique. And so if we only focus on the sounds or the loose feet that are making fast sounds, we're missing that tap, just since you brought up tap, does have a lot of loading, jumps, turning, and dynamic movements that can theoretically put the knee at risk. And tap specifically, a lot of those movements are being done on edge work. So, it's really working. You have to have extra stability elsewhere because you're hoping your ankles are going to have a little extra looseness to catch some edges and make a few extra sounds in there.
Right.
Another style that we could think about would be like ballroom, where there's a lot of loading and up and down with a partner, and that's cueing very differently as well. So a lot of that, they're focusing on working with the floor in and out. So a lot of those conversations are about working through the floor. Additionally, a lot of times in, let's say, a ballroom technique, there's kind of a knee together moment, let's say like a Latin or a rhythm type style that perhaps, again, if you only focus on the knees coming together, you're missing what is causing that, how the foot and ankle is placed, how the hip is placed. So that it is not just that, let's say ballet or jazz or modern talk about the loading, but it's how you're speaking about it specific to your dance style.
It's fascinating. Thank you. So the typical progression of knee injury in a dancer, if you could talk a little bit about that, and then what is typically the timeline from diagnosis to treatment? How long should they be waiting to pursue care?
So with dance and knee injuries specifically, a lot of it is overuse. So the earlier we find out about it, the quicker the process, because as overuse injuries get more overuse, that's the whole reason that we're here, we get more and more problems. And specifically with the knee, a lot of overuse knee injuries, we never say all or nothing in medicine, but knock on wood, a lot of the overuse injuries in the knee, we can dance through. A lot of them, we don't have to take our dancers out of class or out of performance. And the earlier we get on them, then I can hand them over to Maddison and let her to speak about what she's going to do with them. But we're able to kind of get them into Maddison, keep them dancing while doing rehab simultaneously. So we're not getting to that severity where they're actually out. It's a little different with some acute injuries, like we can have an ACL tear, that we hear about, a major ligamentous tear. I mean, that's months to maybe a year before your full dance. That surgery, that's a whole nother thing. But Fortunately, those are much more rare in dancers than in other sports because of how much we train our landing. So that's mostly the overuse that we really, really need to get on early and send over to Maddison so that they don't actually have to come out of dance class or performance.
It's definitely important, just like Dr. Davenport said, to get in early when you're having this uncomfortable feeling in your knee. You're like, oh, I'll just dance through it. And if you maybe the next week say, oh, I still feel a little bit, I'm going to keep going. That's going to be kind of the longer you wait, the harder it is to kind of get it back. And like Dr. Davenport said, then you have to take time out of dancing, and that's not what you want to do. You want to keep dancing because it's what you love doing. So I think it's definitely important, again, and as soon as you can, to see a doctor. And then when you come to the PT side of things, we can kind of, just like we talked about before, kind of check up and down the chain, see what we need to work on, whether it be core strength, hip strength, foot strength, ankle strength, mechanics, things like that. And maybe we have you hold off on doing jumping, or maybe we have you hold off on like a specific thing in whatever dance style you're doing. So that way you're not continuing to aggravate the problem. But you can still do everything else, and you don't get deconditioned, and you don't basically lose all your skills and everything that you're working for.
That fascinates me because in other activities, in the youth athletes, so to say, if you have an injury, you kind of have to sit it out for a while so you don't aggravate it and twist it in the wrong way. So I find that fascinating. You spoke of patellofemoral, and would you consider that an overuse, or is that more anatomical?
It's a little bit of both. So a lot of times it has to do with anatomical alignment and how that knee is working with the knee mechanics in a suboptimal way. So the knee is not going, exactly in the mechanical alignment that we would ideally want it to. And then we're doing that suboptimal movement over and over and over again. So just doing it once, probably nothing happens, but then over time, now we get forces through the knee or through the kneecap, that kind of area where it's not going exactly how we'd want it to, and we get an irritation there.
Perfect. And so does that often lead to a clicking or popping sound that dancers, or are they two different, clicking and popping?
So clicking and popping and locking, I will put in there, are a little bit different. So a lot of dancers click and pop all over the place, and you can get some clicking with patellofemoral pain. That is something that can happen. And I don't really get excited about clicking and popping. So when my dancers come in and they're like, oh my word, I have a click, I'm like, yep, most dancers do. But I also don't ignore it. So it sounds a little flippant when I say that. So I try to reassure my dancers click and pop, but I also want to say, okay, dancers click and pop. It doesn't necessarily mean it's an injury that we're going to have to stop dancing. We're not going to do surgery for. We're not going to do crazy things for that. But that doesn't mean I'm going to be satisfied with it. I am going to try to figure out what's going on that we're having clicking and popping and Rice Krispies in there and all kinds of stuff that people can feel. And can we stop that? Because the clicking and popping might just be clicking and popping, but it might be something that's a little precursor to another issue or another injury. Locking is a little different. So locking is where I'll have someone come in and say, I had an injury and now my knee actually gets stuck and I literally can't move it. And if I kind of shake it around, then it can move again. That's locking. That is when I'm like, ooh, we need to look at that. Is there something in there, a tear of something or something that's actually getting stuck mechanically? That's a whole different conversation of when things actually lock and it can't move.
Right. Okay. So those are some good audible and obviously physical signs, but are there any other physical signs that would alert a dancer to seek treatment, like swelling, or I'm trying to think of other symptoms, but.
Yeah, definitely the locking one we want to know about. The other one is swelling. If swelling tends to happen, can be normal. We can have swelling in the knee, but I definitely would want to know about it. And certainly if it's been an injury and swelling together, really want to know about that one. And then the third one is instability, and dancers tend to be very aware of their bodies and they know the difference between this feels really flexible and really movable versus, oh, I can't keep my knee together. It really feels unstable. Every time I go on it, it's like a shift. Those are kind of the three, the swelling, the true locking and the instability that I'm like, we really need to take another look at that.
Madison, do you want to add anything?
No, those are the big three, especially the instability. I mean, the instability generally you're going to find comes with some sort of injury. So if you are having that injury and you're continuing to have problems, maybe pain's not exactly your problem, but every time you try to go up on a releve or anytime you're jumping, your knee's giving out on you and you're collapsing, that's going to be a sign that something else is going on inside that joint. Something's not holding it the way it's supposed to. And then pain and swelling, yeah, if any bruising, that's not from falling on it. But other than that, I would say those are the big ones to look out for.
Great, thank you. So we've spent a lot of time talking about the knee. If we go a little bit lower and we hear about shin splints, what are they, and can shin splints lead into anything more serious?
Yeah, so shin splints, the technical term that we say in our little medical charts are medial tibial stress syndrome. So that means and I like that because it really breaks down what it is. So medial is on the inside. So it's on the inside of the leg, tibia. That's the big bone of the lower leg that goes between the knee and the ankle. So it's on the inside of that bone and it's a stress thing. So I like that because it explains like what's going on. We're getting stress at that area. And a lot of times we get it again, it's an overuse injury. A lot of times we do see it from a lot of impact. So this is one that I actually see quite a bit in my tappers because there's a lot of throwing and impact and into the floor. I see this a lot of my jumping styles. So people that like to jump a lot, or they're like, oh, that's my thing, I love to jump. Something that is really impact related, and we can do a lot of therapy for it. So again, if we get on top of it earlier, we can really help it. But then if, dancers a lot of times can push and dance through it. And when that happens, it actually can become something more serious. So this is really at the attachment of all these muscles into the bone. And if the bone itself starts getting more and more swelling, then we go from like a muscle stress, bony issue into a true stress fracture of a bone that actually in an area of a bone that actually doesn't have the very best healing potential. So it's actually a pretty bad one. This is one that can take you out for like months and months and months and months. So that's what's a little scary as a doctor when I see someone come in. I'm like, oh, is this something that we can just do some PTs and then to medicine, work through this? Or is this something that we're going to be like out for a long time? Like it's a very, different thing. And the sooner we know about it, hopefully the sooner we can be on the former and make sure our dancers can still dance.
Yeah, when they come to me and it is something we can address because it's been something that's you seek medical care a little bit sooner, it usually is a little bit of a faster recovery. A lot of times with that, the shin splints, as we call them, you have a lot of tightness in some of those muscles on the inside of inside front of your shin. So we can work on massaging them, trying to loosen them up, loosen up some of that soft tissue. You can work on some self-massage techniques too to kind of loosen them up. And then we also want to strengthen some of those muscles because basically there's so much demand on those muscles to do all of this jumping or tapping or whatever dance you're working through. And you need to be able to use those muscles to control that. And if it's too much for them, that's when you run into those problems. So we actually have to make sure they're strong enough. And then again, just like we talked about before, going up and down the chain too as to what else might not be working in order to help absorb the shock from jumping or whatever you may be trying to push through that's not working for you.
And I'm going to put you on a spot and ask a question that I didn't tell you I was going to ask. But what are your 3 favorite exercises for people who have chronic shin splints? Because I know when dancers get these, we can manage them, we can get them on, we can do a lot of great things. But I would love to hear your favorite things that you said, like, okay, if this is something that keeps coming back, we get into nutcracker season, you're doing this one roll, it requires a lot of jumping. What's the 3 that you're like, make sure you do these through that season?
Yeah, I would say a big thing is strengthening the muscles on the inside of the shin. So the muscles that invert your foot, so that pull it inwards. So you can always just throw on a resistance band around your foot as if it's pulling your foot outwards and you're trying to pull your foot inwards to kind of fight against that resistance. That's going to strengthen those inverter muscles, the muscles on the inside of your shin there, to keep them strong. And then you also want to work on, for dancers in general, dancers that are up on their toes a lot will generally have strong calves, but it's still important to work on that, especially that soleus muscle. So you have 2 big calf muscles one that works really well with your leg straight and one that works really well with your leg bent. When you're absorbing that shock and you're coming down and you're landing maybe from a jump, you have to be able to bend those knees to absorb some of that shock, but you also have to use your calf muscle to do some of that work. So the soleus muscle a lot of times gets forgotten about. So that one can actually be worked with your knees bent, so in a slight plie, going up onto a releve. So going up onto your heels. That one's also, or excuse me, up onto your toes. That one's also a really good one. And I would say doing some self-massage techniques, even though it's not an exercise, that one's going to be a big one as well. But if I had to pick another exercise, I would also say stretching. Stretching your calf is also really, really important when you are up on your toes all the time, if that's part of your dance style.
Dr. Davenport, you read my mind, because I was thinking the same thing, from what angle are you trying to do the exercises? Is it the strengthening the calf, or do you also want to strengthen the thighs?
Always. So, I mean, again, hip strengthening, like I said a little bit earlier, is always something that we're going to work on. So I feel like that maybe not be specific for the shin splints. That's just for any dancer. I would say it's really important to strengthen your hips and to always have that incorporated to the routine. So it's hard to pick three.
Yeah, I know, I can imagine.
But yes, I'd say working on hip strength. So an exercise like a clamshell is a really good one, keeping your feet together, lifting your top knee up. You can also do that in a side plank. It's a little more challenging. A lot of times dancers are in generally good shape, so they can exercise a little bit beyond just the basic exercises. So if you go up into a little plank on your side with your knees bent, and then you lift your top knee up like a clamshell, that can be a good one to target both of your hips, actually.
Wonderful. So it's funny that we're talking about exercises, because we did a Zoom poll, and we asked our participants about if they feel they're doing good exercises for long-term knee health. And for the most part, the answer was yes. And there was a few unsures and a few no's. So I think you addressed some of the other exercises that you think are good, but is there anything else you think you would add into that?
Yeah, so just in general for exercises, keeping a good strong core is really important. A lot of times in dance, you want to be as tall as you can and really present yourself. And a lot of times that just ends up to maybe arching your lower back or kind of sticking your ribs out a little bit. So always working on your core. I mean, your core in general is also really important for your knee strength. For your knee health. So keeping a strong core with some planks. You don't want to do like your sit-ups, your crunches. Those aren't really going to help your core at all. The kind of more stabilizing muscles in your core are a little bit deeper. Those work better with stability exercises like a plank, like a dead bug exercise, or some Pilates style exercises, laying on your back with your feet up in the air, keeping your core nice and tight. There's a lot of different variations that you can do from there. But again, the core strength is important for everything, not just lower body, upper body too.
I do feel, and this probably has been very common in the dance world, but for years, but I feel like Pilates is making a comeback in terms of the core strengthening and the back strengthening. So, and happy to see that, because there's so many benefits to it. The other questions we asked in our poll, which is nice to see that many are doing cross-training exercises outside of dance. And then the one that most were unsure about is if their dancing is promoting healthy joints. So, I don't know if dance instructors, they're teaching to the dance, right? They're not teaching to healthy joints. So it may not just be as obvious. Or is there something you think that, dancers should be seeking when they're getting instruction?
So in general, for this lecture talking about knee health, I think we could go through each individual joint, and talk about kind of pitfalls or things like that. And we have so many lectures coming up in the coming months that maybe we could ask this question again about hip health or ankle health or things like that. Specifically talking about knee health, again, I kind of alluded to it, but the amazing thing about dance training is that we train jump landing, and we have miles of scientific research that show training jump landing protects knees from major injuries. So we still will see, an ACL injury in professional ballet, but if you look at that data compared to professional football, soccer, basketball, any other professional traditional sport, it is so minuscule compared to what you see. So you can always find a case, you can always find things there, but in general, the amazing way that our dance teachers and dance instructors train our jump landings and how to get up, off and down the floor and how to load and not load is actually very knee healthy. So you can always do horrible things to the knees. You can land on them too hard. You can be in choreography that's rough on the knees. But in general, dance tends to do the number one thing that we know can help knee health long-term, which is really focusing on that jump landing and how to load that knee.
I think it's also important too to make sure that with your training and with your dance, you don't start building back up too much too soon. So let's say you are getting back from an injury and you took some time off, or if just in general, you're just getting into dance. You can do too much too soon, and that can cause a lot of the issues in the knee that we've talked about, or in the lower leg, like the shin splints. So you want to kind of slowly build yourself up. Don't just jump from being off from an injury, working with your PT, to all of a sudden full swing in your 4 hours a day of dance. It's not going to go well for you. So promoting healthy joints also is important to kind of slowly build back up if you've taken some time off, and not to jump your training up too quickly. Let's say when you're going into the summertime, you have more time maybe to dance. You want to be careful that you aren't maybe doing too much of one thing too. So don't do too much jumping or too much of something else, because those can lead to issues as well.
Yeah, that makes sense. Curious on the jump landing, is that something that is addressed early on? So in the, young dancer, or is that at a more serious stage, when they're teenagers? And so how do you like that? What's learned and then reteaching what's been learned from a young age?
So for most classical dance, we consider kind of our ballet, jazz, tap, modern, contemporary. That's kind of our classical dance tap. Sometimes people put there or not. But certainly for the ballet, jazz, tap, modern, ballet, jazz, contemporary, modern group, it is something that is taught very, very early. Your very first thing you learn is a plie, and that is your pre and post jump. So that is kind of your basis of that jump. And the very first thing you learn is how to do a plie correctly, so that by the time you are an advanced dancer, you are really over plie as a concept. And then sometimes we do get injuries, and we can like fall in love with these basic techniques, because there's so much more to learn and explore within those basics that we're like, oh yeah, I know how to do that. I learned that when I was 2. Like, I do not need to learn that when I am 22. But then we learn, oh, there's so much more to this, that so many more muscles and so many different ways we can place our feet. So it's something that we learn as a basic very young in dance technique, but then we can relearn it and fall in love with the basics as we move through the dance career.
Perfect. And switching topics slightly, I know we talked about rest when you have an injury or an aggravated muscle or joint, but what else would you recommend? Heat, ice, which one's better?
And yeah, that's a great debate. We could probably spend a whole hour debating heat or ice. It's a very big debate in medicine, but I do want to address rest, because Maddison said very well that we really try to focus on relative rest. So if we need to bring a dancer completely out, shut that dancer down, take them out of class, fine. But not fine, not great, but we will, if we have to. We can be the bad guys in medicine if that's what's the right thing for the knee and the long-term dance opportunities down the road. We will be the bad guy and do it. However, most of the time we don't need to do that, and we focus on relative rest. So relative rest is saying, okay, we're not going to do big jumps, or maybe we're not going to jump for knee health, or maybe we're just not going to do floor work, or that really weird choreography where you fall on your knees. Cut that out. We're not doing that anymore. So maybe we do that. Maybe we modify some of the activities so that we're able to still keep dancing and doing most things, because actually we can get dancers back from injury quicker if they're able to still do a lot of their dancing, which makes sense, because then we're not having to recondition everything. We're really just able to focus on those knee mechanics, let's say, and get that back. In terms of ice and heat, I might kick this one over to Maddison to get her input. A lot of times our mantra is early on in an inflammation or injury or right after activity, ice, and then heat to kind of warm up. But there really aren't a lot of clear studies that say one or the other is really going to get us back faster necessarily in terms of return to dance. But I'll let Maddison chime in there as well.
Unfortunately, there is no right answer. So exactly like Dr. Davenport said, if you've just had an injury, let's say, I don't know, let's say you twisted your knee and dance and it's been really sore, it's a little swollen. You want to put some ice on that, calm it down. You want to do that for as long as it stays swollen. But if it's more of an overuse injury, which is a lot of what we've been talking about, ice or heat, it's something that's been going on for usually a long period of time. So you really could use either if you've had a hard day and it is swollen up, maybe after dance class or after a show that you've had, you notice it's a little more swollen at the end of the day, you can throw some ice on that. And like Dr. Davenport said, you can always heat to warm it up. But is it one necessarily better than the other just in general? No. I wish I had a better answer, but no.
And similar to that, before one even has an injury, you know, and they've had a really long day of dance, is there anything they can come home and do, you know, like an Epsom bath or, you know, hydrate, or, you know, what other tips would you tell someone to help them prevent besides the exercise?
So I would add hydration and refueling. So a lot of times dancers are dancing during prime eating hours. You know, a lot of times it is during dinner. And so maybe eating us, and it can be difficult for some dancers, not all, but some dancers really don't love to have a large meal right before dancing. And by some, I mean a lot. You know, it is tough to like have a giant meal and then go jump. You know, that can be hard and not feel as great, you know, for your dance technique. And then you get home and it's late and you have other things to do. So, but refueling is essential to giving your body all those nutrients back that you've just been using to make sure that it can recover. So a lot of times dancers sometimes will do like lying in a stretch as a recovery, which may not really be sufficient to get back everything that's been expended in that dance class. So really hydrating really well, making sure you're throwing some electrolytes in that hydration, really refueling really well, making sure you're getting back all those nutrients that you've expended, and then adding in some really good maybe stretches, maybe rolling out, maybe a few strengthening, stabilization things that Maddison could hand out and give them at the end of class.
I think from the PT standpoint, I would say that stretching, it depends on what you're trying to stretch. So if you just stretch, it's not necessarily going to help. It might have to be a little bit more targeted, and I can't give an exact, this is going to be good for everybody. It depends on the style of dance. And again, a lot of times, depending on the type of dance you do, a lot of times you're a little bit more flexible than you have to be. So you have to be careful with how you do stretch and make it intentional, and make sure you're stretching a muscle, not just moving into emotion as far as you physically can. And then rolling out. So if you feel like anything is really tight, using foam roller or using like a little massage stick to kind of help your muscles recover, reduce any chance of muscle soreness will help as well. An Epsom salt bath always feels good too. Maybe your feet are a little tired if you're not used to, maybe you're breaking in new shoes, or maybe you have some new blisters. You could always use an Epsom salt bath to kind of soak your feet out.
That sounds lovely. And to your point, Dr. Davenport, later in our series, we do have a topic addressing nutrition. So that will be relevant for the dancer as well, just because it can get more details on that as well. I know I saw a hand up amongst our audience, and I would just encourage you to include your question in the Q&A at the very bottom of the screen so that we can make sure we address it. So another question, you know, if a dancer was to go to a doctor or physical therapist, how do they know that they're seeing the right provider, you know, based on their experience with dancers?
That's a great question. It can be scary as a dancer, you know, especially you want to continue dancing. You want to make sure you're getting the right doctor, the right diagnosis. I never get upset when my dancers want a second opinion. I just had one this week who has known me for years, loves me for years. We have a very serious diagnosis we're working on. They're like, they're so scared. Like, are you offended if I get a second opinion? I'm like, no, this is who you should go see. Go talk to them, like it's fine. And so that's part of it, is if your doctor, that's one of my rules of thumb, is like, if they're confident enough in their diagnosis, they're gonna be confident enough that as like, go talk to them, come back, we'll go through all the data, and we'll figure it out. And then part of it is, do they really understand what you're doing? Now, I treat dancers, but there are many, many, many styles of dance out there, and there's no way I can possibly learn all of them. So if I have a dance style that I am not intimately familiar with, I'll be like, okay, show me that move. What are we doing? What are the mechanics? How can we go through that? So you can't always expect your dancer to know every single intricate move that's there. But if they're interested in learning how your mechanics function, your doctor should be good at mechanics. They should be good at knowing alignment and knowing where stresses are going through the body that could put you at risk for injuries. So if you're feeling like you're not getting very specific attention to your individual injury, I would say that you go like, question mark, maybe this is not the one for me. And then of course, experience, so you look at our resumes, our CVs, like it's very clear we've worked with dancers for many years, and that can give a level of confidence to my dancers. Like, okay, at least you have an idea of what the difference between a point shoe and a tap shoe. Like, at least I have something. Okay, this doctor seems like they know that. We'll start there. That might be a low bar, but at least that's something. And so those can be some little cues. There are organizations that like HSS that has a performing arts medicine collaborative, but then there are national and international associations like IADMS that has a find a provider search, so people who are experienced in dance medicine. So there are different ways that dancers can find a provider near them who understands their needs.
Wonderful. Thank you. How about you, Madison, from the physical therapy perspective?
Yeah, so if there isn't anybody close by to you that maybe is specialized in dance medicine or has worked with dancers before, kind of what Dr. Davenport was saying is do they look at you, what you're doing? So a lot of times in PT, we're trained to assess motion and kinematics. So we're trained to assess how you're moving. But if the therapist just is looking at how you're moving in a very specific way that doesn't really relate to anything you're doing, then maybe that's not the right fit. You want to make sure that they can see what you're actually doing. So, if they don't even know what a plié is, that's okay. A therapist, again, is trained in assessing kinematics and kind of figuring out what's wrong. So as long as they say, show me what you're doing, show me what's hurting you, so we can kind of see maybe if there's something mechanically going wrong that we can work on and fix. So that's really important to assess kind of your plie, your releve, if you're a dancer for ballet. I worked with an Irish step dancer one time, and I had never seen one before, and it was quite interesting to kind of learn what she was doing. So you just want to make sure that they're actually getting to know kind of what you're working on and what you're doing, so that they can better help you.
That's wonderful. Thank you. We have a couple questions that have been submitted. So the first one is it common to see injuries with dancers who perform on a raked stage?
Really great question. So a rake stage is a challenge. So we do see different injuries in a rake stage. And a rake stage, I put a rake stage at the same category that I would put like a new shoe, or a new style, because it's a new thing you're doing to your body. So I do see injuries in dancers who transition too quickly to a rake stage when their body's not used to it. And that is really one of the biggest problems with rake stages, is that dancers are taking class with a regular flat studio floor and then having to perform on a rake stage. And so their body is not adjusted to that load. And then a lot of choreography on rake stage might be one-sided. So then one side gets really off. So if a dancer has a gig or they're in a show and it's going to be on a rake stage, really starting early with physical therapy to really work on imbalances, because that kind of slope that has can really put in imbalances that the body is not used to. And so absolutely, we can see some very weird injuries come out that are unexpected for the dancer when their body hasn't loaded appropriately. So I always say to my dancers, if you're going to start a rake stage, like get into therapy prehab. Like that's not waiting for something to happen. Get in prehab, really work on those imbalances so that run of however long that show is going to be, we can really try to prevent some injuries there.
I think another thing too with just surfaces, it's important too is if you are practicing things at home is to make sure that you're doing it on a good surface. So let's say you want to practice some of your jumps at home, make sure you're not doing it in Florida, there's not that many basements, but in other places there are. Make sure you're not doing it on a cement floor or in your driveway. Find something that's a little bit more absorbing of the shock, because that can cause some issues as well. Especially if you're landing, let's say on something even too soft, you land and maybe you're going up for a jump or a spin, your foot can get stuck and your body is still moving. So you have to make sure you're also paying attention to what surface you're working on.
Wonderful, thank you. So you brought up a good point, Dr. Davenport, is, if you know you're going to be on a certain surface or doing something new and you want to do something preventatively. So there's physical therapy, which you can do. We've talked about Pilates. Is there anything else that can be done like a prehab or preventatively to prepare someone for a show or a gig of sorts?
Great question. So there's actually several things out there, and just like anything, just like finding the right doctor, the right physical therapist, sometimes it's a fit of what your body seems to love or what you just love to do. And I look at these as maintenance therapy. So sometimes we'll start with physical therapy and then just need to maintain. And dancers tend to love classes. I'm that person. So I'm really good when I'm working with physical therapy. Then I'm left to my own devices. I'm like, oh, I need some help. So there are several classes and things that can help. So I love Pilates. Gyrotonics also has additional movement and can be super helpful. And then one thing that's out there now that's gained a lot of traction is progressive ballet technique, PBT. And that tends to do really well as well. And sometimes we'll combine some things like doing a pool bar or some kind of aqua exercise because it's less impact, and dancers get a lot of impact in their technique for most techniques, or we'll combine floor bar, which is another core strengthening, cross training types of things. So those are some things that I steer my dancers to.
I think all of those are really good prehab for sure. If you don't have an injury, when you do have an injury, you do want to make sure that you do a one-on-one session with something like that before you just jump into a class kind of setting, because a lot of times maybe small corrections that could prevent you from maybe hurting more would be missed in a class setting, because it could be maybe more of a general correction. So kind of working on exactly what you need might be missing there. So definitely getting that one-on-one time too, if you know you're working through something, so that you're not reinforcing bad habits.
Wonderful, thank you. A couple of additional questions. Are there recommended periods of time a young dancer should take off during the calendar year?
In general, there's not something that's black and white, must take 6 weeks off during the year or something like that. But in general, dance is considered a young specialization sport, similar to ice skating, gymnastics, things like that. And we know from the data that the younger kids specialize, the more risk of injury that they have. So we try to say, if you're not really sure that dance is going to be a career, it's okay to have a lot of playtime. There are many, many, many professional dancers who started really getting serious in their teenage years rather than the age of 10. It really is okay to balance playtime with dance time. And similarly, now that we're in the summer, a lot of my dancers will come in my office in a panic attack. I might have to take 2 weeks off to go to Europe with the family. I'm like, go do that thing. Go take 2 weeks off, have some time, be a kid, be an adult. If you're an adult dancer, enjoy life. It's not all about dance, but I always just say you want to balance how much time you're off with your ramp up time. So you do need to plan it ahead, because the truth of the matter is that if you take 2 months off of the summer and then go back 40 hours a week as a professional dancer, it's just not going to go well. So that's kind of what we want to look at in terms of that balance.
Wonderful. Another question that's come in is, how does intrinsic foot muscle strength tend to be in dancers?
Good, and not as good as it could be. So it is something that we look at. We have a pre-participation dance screen that's similar to other sports dance screens. And we do check that because it's something that is essential. Thank you so much for that question. It's such an important part of stability in dance. And it's something that is so important to make sure that we focus on, especially when we're talking about the lower limb. Obviously, foot intrinsics are important for everything, including the knee, but those lower limb, those shin splints, the stress fractures of the leg, we really do want to make sure those foot intrinsics are really, really strong, because we're asking so much of the feet of the dancers that they need to be extra strong. And I'll let Maddison speak on that a little bit as well.
I'm sure they'll be going over to some more specific foot intrinsics as well later on in the series.
Yes.
But with the lower leg, yes, it is very important. And again, just with every other body part up the chain, the hip and the knee, it's important to have those strong foot intrinsic muscles. And just like Dr. Davenport said, usually dancers are strong, but they could always be better. So a lot of times the way to tell if you're maybe not as strong as you need to be is if you are dancing barefoot and you notice your feet are clawing a little bit, like you're gripping with your toes. You can't quite keep your weight even on your foot, or you're having some balance issues as well. A lot of those are signs that your foot muscles could be a little bit stronger. So foot intrinsics, those are those small muscles that originate in the feet and they control motion in your foot. You also have extrinsic muscles that come from outside your foot, and they start usually in your lower leg and then they attach in your foot. Those ones are also important. But a lot of times the foot intrinsic muscles are going to be really the ones that are controlling the shape of your foot and the way you can balance. So with those muscles, you definitely want to work on every little individual toe. So you've got the big toe, you can just work on lifts of the big toe, keeping your little toes down. You can work on lifts of your little toes, keeping your big toe down. You can work on some doming and some arch lifting. All of those exercises strengthen those intrinsic muscles in your feet. And again, some of the extrinsic muscles too, but those are all important.
Wonderful, thank you. And we'll definitely address the foot and the toes more on July 26th. So I encourage you all to join us again. Another question that's come through: if somebody's experiencing twists during walking, suddenly, which treatment option, or what would you suggest they do in terms of exercise or care? I mean, really, it's probably very individualistic.
Yeah. So I will speak from the medical standpoint, and then I'll let Maddison speak with any physical therapy exercises to help kind of that lateral chain, so that you're not overloading the lateral chain and making sure that you're putting stress through the medial chain, so you're not constantly on that side. From the medical perspective, we ask a lot, this might be a very specific question about the kind of, are we rolling a lot, or is the knee? So first we need to figure out, is it hip weakness? Is that why the knee and the ankle are getting overloaded, or is it ankle instability and that's why the knee is giving out? So first of all, we just need to figure out the body part that's really the number one. It's probably all three. It's probably hip, knee, and ankle, but we really need to figure out what's our primary player and then what's the victims of that one and might now have its own issues. So first we need a really good diagnosis. If it's something that's been happening a lot, we probably need to get some imaging and see, like, do we have any ligaments left? Have we had so many ankle sprains that we now don't have any ligaments and we have muscles being overused? If it's the ankle, or is the hip super duper weak and that's putting stress there? So we first, before we get too excited about how to treat it, we need a really good diagnosis of what our primary player is, as well as, do we need additional imaging to see if there's a structural instability and not just a functional instability? So those are some of the things that we need to address. And then I'll let Maddison talk about kind of how we have that functional stability.
Yeah, so like we've talked about kind of throughout this whole webinar so far, is the hip strength is really, really important. And again, a lot of times people are weak in their hips, so it never really hurts to strengthen your hip. You're only going to help yourself. So looking up and down the chain, you want to look at the motions that are causing the problem. And if you do find that the hip is weak and maybe some of that kind of dynamic instability is coming from that area, you can work on strengthening. A big player is your gluteus medius muscle. It provides a lot of stability for your hip. So I talked about before the side plank with the clamshell. That's a really good exercise. You could do some side stepping with a band around your knees or your ankles. It's better to start with it around your knees because when you have the band around your knees, it kind of forces you to push your knees outwards into that band. If you put them around your ankles and you're doing side stepping, it's a great exercise, but you're probably not actually getting your hip muscles enough or as good as you could be. So when you have that band above your knees to start that exercise, it gives you that little cue to push those knees out, which can again be a big problem. That's why you're coming to me in the first place. And then in general too, you want to also focus on not only the hip strength, but the hip mobility. So sometimes we do try to force our turnout because we want to go as far as we can. But sometimes just the range of motion, the mobility in the hip is not exactly there. So we can look at some mobility exercises as well if that's needed. But again, it depends on the person. Sometimes dancers are very hypermobile and have great flexibility. Other times maybe they're a little bit more restricted. And again, it depends on the type of dance that you're doing as well.
Wonderful, thanks. Something that you mentioned earlier, Dr. Davenport, is the type of imaging someone might need. So when a dancer goes to see a physician, what should they expect in terms of the progression of imaging that might take place to diagnose?
So a lot of overuse injuries actually don't require imaging. A lot of it is a clinical diagnosis. It's functional, how dancers are moving, what muscles are activating or not activating. So we don't automatically have to get imaging just because there's pain someplace. But when we do get imaging, we usually start with x-rays because again, that gives a best sense of alignment of how things are lined up. And so the x-rays can really give us a great idea of alignment. But then we might need to progress. Usually the next thing we might need would be an MRI because an MRI looks at soft tissues more. And we talked a lot with dancers, how a lot of them are a soft tissue issue, so like a tendonitis, that would be a soft tissue rather than a hard tissue on an x-ray. So if the x-rays look pretty negative and the alignment looks pretty good, functionally they're moving, but we still have a lot of pain, the next step is usually an MRI to see if there's anything else going on that we couldn't see otherwise.